Welcome back. Every Wednesday, we like to ask the vet using some of our viewers' questions on how to best care for your family pet. Joining me once again is Dr. John Faught from the Firehouse Animal Health Center in West Austin. And thank you so much for being here.
Thanks for having me.
Today you brought a cat. Normally you bring a dog. Today a cat.
We try to rotate them in and talk about different topics. So this is Butters.
Butters. And Butters is a 5-year-old. What type of cat?
He's just a domestic medium hair cat.
Kind of a mutt.
Well, just kind of a regular, normal cat.
A normal cat.
Yeah.
Well, today we wanted to address some of the feline questions out there, a lot of cat owners out there. So one viewer question is that her cat, this is from Lisa, her cat licks its belly until there's no hair there. Is that something to be concerned about?
Well, it can be. I think there's a handful of different causes that we try to look for. One, obviously, the obvious thing is parasites. We're always looking to make sure they don't have fleas or something that can be a cause with that. But some cats will actually do that related to allergies. We have a lot of allergies in Austin, and that can be a manifestation of that for cats. I think Butters does a little bit of that as well. So we're always trying to make sure there's not an allergy component, which should be some sort of a seasonal thing. And then some cats actually, they can have more serious endocrine diseases, but usually there's other symptoms that go along with that. And then the last thing we try to look for is if there's some sort of anxiety or stress factor, because that can be just almost an OCD behavior for them.
Interesting. This next question is from an anonymous viewer, and we apologize because it is during the lunch hour, but their cat throws up periodically, and not just hairballs. Is that something to be worried about?
Yeah, I think that some cats do just throw up regularly, and so we're always trying to decide, is this a big deal or not?
Right.
A lot of that depends on, I think people always come in thinking that it's hairballs, but sometimes it is and sometimes it isn't. I always tell people if you see big balls of hair, then we try to blame it on hairballs. If we're not seeing those things, then we don't always blame it on hairballs. What I always encourage people is that if it's a very infrequent thing, then it may just be a normal thing for the cat. But if it changes from the norm, if they used to do it once a month and now they're doing it once a week, then maybe something to consider.
Right.
Or if they're just acting more sick or having other symptoms, we want to take it.
Change in behavior is more of a telling sign.
Sure, sure.
Kelly writes in, I have a fat cat that sleeps all day. How do I get him to lose weight if he won't exercise?
Yeah, that's a common question. So cats, have historically been hunting and running from predators, and they've been chasing after their food, and that always kind of kept them in shape. And so I think now a lot of cats live indoors with a big bowl of food, and they spend most of their day sleeping and eating.
Yeah,
it's kind of a deadly cycle.
Living a cush lifestyle.
Right. So we try to, we encourage exercise. I think if you can use feather toys or laser pointers or that kind of thing, it will help to kind of work on the exercise. But the thing that I always kind of encourage my clients is that, when I got on a treadmill for the first time, I realized it took me an hour to get rid of a Dr. Pepper. And so sometimes it's easier just to not take in the calories. And so if they're not exercising routinely, then sometimes it's easier to fix the food bowl issue than it is to try to get them to wear it off.
Taper off on the diet a little bit.
A little bit, yeah.
Jack writes in, my friend is getting her cat declawed. Is that cruel to do?
Yeah, that's become kind of a hot topic to talk about. I mean, I think it's growing to be more taboo to get cats declawed. Yeah. I always kind of temper that with, there are a lot of cats that have been declawed and done really well, and it's really been a good thing for them to have a good, safe home and not be given up or whatever else.
Right.
So what I try to encourage people is that I try to explain what's really involved. You're really amputating the last bone in the paw. There's potential complications with that. There's some potential pain or discomfort with that. So we try to give people all the options as far as the things that you can do before that. And if it has to be done, then there are some new techniques and ways of doing it that can decrease the pain and complication rate. But we try to kind of talk it through really well and make sure clients are really prepared for making that decision.
Get all the information first before you make your decision.
Yeah.
Dr. John Faught from Firehouse Animal Health Center, thank you so much for being here.
Yeah, thanks for having me.
All right. We like to ask the vet every Wednesday, so if you have any questions, please send them to askthevet@kxan.com.